Good day, dental professionals. Welcome to the Dental Flow podcast. We are dentistry's go-to resource for insights into the business side of dentistry. Your host, Benjamin Suggs, will be helping you navigate through the currents of the ever-changing dental waters. This podcast is packed with innovative practice growth strategies, actionable insights, and expert advice, all tailored to help you elevate your dental practice to the next level. If you're ready to dive in, so are we. Let's get into the flow.
Hey, dental superstars. Welcome back to the Dental Flow podcast. Today, my guest is Dr. Bethany Brenner. Dr. Bethany Brenner, you are one of the top TMJ and sleep apnea dentists on the entire East Coast. I know this because I know that even though you're based in Burlington, Connecticut, that you have people travel from all over the place to come to you for TMJ and sleep apnea treatment. Your specialties goes beyond that. I know you're certified in DTR, which maybe you can give us a quick what that actually means. I know it's treatment of facial pain and migraines and vertigo and popping jaws, excuse me. But Dr. Brenner is also a certified health counselor. She has studied integrative nutrition and she's a holistic health practitioner. And I know that all of those things really come into your day-to-day and how you treat these issues that people have. So Dr. Brenner, thank you for being here today.
Well, thank you for asking me.
Absolutely. It's our pleasure. So let's jump right in. So I really am interested to learn more about TMJ and sleep apnea, given your expertise in it. And I know that a lot of our people listening will benefit from this as well. So let me just start by saying or asking, I know a little bit about your practice as we've known each other for a couple of years now. So I know that when it comes to TMJ, you're really focused on more of the root causes versus, those little temporary relief kind of measures to treat TMJ. So maybe you can just share with us like a little bit about your approach, but also just what are some of the misconceptions that patients have about TMJ and the pain and all that?
Well, first of all, they think it's a quick fix. And second of all, they don't think it's connected to sleep apnea at all. And almost 100%, I have to say 99, because we test almost everybody that comes in. They have some form of sleep apnea. Now, most of it's mild to moderate. I get a few that are severe, but it's about how their whole health is, what is their age, what are their medical complications, what medications they're on. And so we really have to do a screening so that they understand, and I explain to them how this is connected. And that's where we begin.
So a sleep apnea test, is that something that they do in a clinic, or can you do it at home, or how does that work?
Actually, we facilitate it. We have a physician that will read the sleep studies. They're the ones that obviously get to diagnose and offer up choices of treatment and order the treatments for these patients. But they've been working with me so long that they allow me to hand out a ring device. Now, this ring just slips onto your finger. It Bluetooths to your smartphone. So there's no wires and gadgets and wrist cuffs and large things, and they don't have to go to the store. They don't have to wait for it to be shipped to them. So basically they're borrowing our ring device, and we set them up, and we do have them do 2 to 3 nights, whatever's most convenient for them. And we even have ones for children. So it's all ages, and we facilitate that, and then we see what the sleep physicians have to say.
That's great, because I can imagine a lot of people think about being tied up to all those monitors at night, and they're going to be like, "How was I going to sleep anyway with all this stuff on me?" So the ring is really cool. But you also, I really would talk about. You mentioned children, and I've actually, being a parent of 2 younger kids now, I've been reading a lot about sleep apnea is being diagnosed a lot in kids, and it's something that I guess we never really thought that was something that would happen. So like, I know you treat a lot of kids with sleep apnea. Can you talk a little bit about that and maybe share some insights into what's going on?
Well, children have a wide variety of symptoms, and parents are just thinking it's normal. For instance, a lot of these kids have asthma, a lot of allergies, and parents just think they got the sniffles all the time, and they become very hyper, get diagnosed often by the time they start school with ADD or ADHD, and parents struggle to have them cooperate. So these kids don't want to go into bed on time, and they have troubles with concentration and focus. And the other things that they have sometimes are anxiety. Bullying is another one that a lot of the counselors see at school. And so we have these kids that come in. One in particular, I could tell you a situation. He was 13 and looked like he was 8 years old. So we call that failure to thrive. So he's got a stunted growth. And that young man grew 6 inches the first year we treated him.
In 1 year after getting sleep
Yep,
apnea diagnosed and treated. That's
yep,
amazing. So
yep,
just the lack of oxygen at night, it was affecting
yep.
his growth.
Yep, and he was a smart young man. He was active in sports, but he just was so tiny. And the physicians didn't know what to do for him. So we immediately tested him, and mom was in agreement. They were already on a wonderful, very healthy diet, and mom is great. And so I'll do whatever I've got to do. And in fact, when we found out that he was a severe apneic, she said, I mean, parents feel a lot of guilt because they didn't notice it, and the physicians they don't spend enough time with these mothers anymore. They're so busy treating COVID and all the rest of it that they weren't even paying any attention to all the other signs and symptoms. So these kids kind of get put by the wayside. And I had another mother that her child, very bright. Actually, he writes music. He's only like 10 years old now. He writes his own music. He's almost like a Beethoven. He's very interesting. They were going to put him on Ritalin when he was 5 years old because the teachers are like, I can't deal with him. He doesn't sit at his desk. He won't sit still. He doesn't pay attention. He's disrupting the classrooms. And so they weren't going to let him go into first grade if he wasn't medicated. Now, can you imagine? And I said to her, and I'd been telling her since he was 2 years old, he had a sleep breathing problem. So we got him tested. He had 42 arousals per hour
Wow.
while
So
he
he's
was
waking
sleeping.
up 42 times per hour.
So basically, he never got any sleep. Okay. So what do kids do when they get hyper? And you can remember holidays where kids are running around the dining room table and it's like they got their second wind. That's overtired. But
I'm not
parents don't know
surprised.
that. So
Even myself, if I have a bad night of sleep, the next day I find it hard to be stationary and sitting. I have to kind of keep
yeah,
moving to keep
yeah,
myself going. So it makes total sense.
yep. So he immediately started to calm down when we started treatment, and we actually used the Vivo system with him as well. So he only had to wear the appliance at night. We did some myofunctional therapy, so he'd learn how to swallow. We started working on breathing exercises with him so that he would start to learn how to kind of slow that down and breathe through his nose, because we do this thing, lips closed, breathe through your nose. And the kids, it's like a mantra, right? So what do we say here? And we have another part is tongue on the spot. So you got to put your tongue in the right place, breathe through your nose with your lips closed. And these kids would then, we start with walking, then we start running, all doing the same thing. And pretty soon this child now sits in my chair calmly and we have these wonderful conversations. I said he's a great kid, but they calm down enough so they now can function in society and be more acceptable.
Gotcha.
That. Mm.
What are some of the negative, you obviously, I assume people with sleep apnea often sleep, like you mentioned, they're not breathing through their nose, they're breathing through their mouth. What are some of the negative things that can happen when you're doing that a lot, breathing through your mouth at night?
Well, I'll give you another example. I had a woman that came in. They told her she had trigeminal neuralgia. She was 30 years old. And she was devastated by this diagnosis. She's like, when you read this, like, you don't have a life anymore. She said, it's terrible. And I want to have more children. She already had two. She had an open bite. What does that mean? That when you bite down, your front teeth don't even come close to touching. And she'd been like that her entire life. She had a lot of neck pain. That's also very common. I'm not allowed to treat necks and backs. I'm a dentist, right? I have to say, okay, let's see what else we find. So when I tested her, she did not have trigeminal neuralgia. That was a complete misdiagnosis by the neurologist. So we tested her for her sleep. She had moderate sleep apnea. So when we started to get her on the way to recovery, she finally started doing so well. She started sleeping well, and she got pregnant again.
Yeah, that's great.
And then she came back and she goes, now if I want to fix my teeth, I said, well, we also needed to get your nose fixed, right? So she had a lot of what we call bony outgrowths in her nose. So some of those are little, she just really couldn't breathe through her nose. So when we had that surgery done, that was the first time she realized what breathing through a nose should feel like. Because you have to remember, these people they've probably been this way their entire life. They don't know that it can be different.
Mhm.
So their normal breathing is stuffed up. And so they just think they're fine. So what is the body going to do? And I often say to people, your brain's going to override everything else. It's going to be in survival mode, and you're going to open your mouth and breathe. And so they hang their mouth open, not a lot. It's almost like this much.
Mhm.
They almost look like they have their lips closed. So when you see that, and I often will give like teenagers or young, maybe over the age of 9, I'll give them a little piece of paper and say, hold this between your lips. within seconds, the paper is fluttering. And
Right.
it's fluttering because their muscles are so weak in the front of their face. They cannot keep their lips closed. Okay. So we have to work on strengthening those muscles. That's myofunctional therapy. We start to get them to be able to breathe through the nose. Sometimes that's exercises and finding out what is the cause of that airway issue. So sometimes we're going to do some expansion of that nose. And as I've said before to many people, for every millimeter that translates into the nose, you get 7 times the airflow.
Every millimeter,
Every
7
millimeter.
times the airflow. That's
So you
amazing.
don't need to open them up more than 2 or 3 millimeters, and they have like, wow, it's like amazing. And their
And
sleep
myofunctional therapy can help with that, with an opening
They
up.
can't do the expansion. No, the myofunctional therapy is going to be for swallowing, tongue placement, trying to strengthen the muscles in the front of the face so they can keep their lips closed. Because we have to open up the airways so that the brain goes, oh, you can breathe now. Okay. Now we have to work on myofunctional therapy so that they can strengthen those muscles. So typically, while we're putting them through the expansion of that airway, we start working on those muscles because we want them to close as soon as possible.
Gotcha. So it's really interesting to hear about, things that were connected to sleep apnea that people didn't even understand were connected. So what are some other stories that you've seen in your many, many cases of people that came back to you and said, once you fix this, I didn't realize that this was connected and this was connected. What other symptoms were they having?
So people have a wide range of symptoms, which is why it's the most difficult to figure out. Okay.
Mm-hmm.
So I have people that gain weight. Nothing they do fixes anything. Well, during improper sleep, your cortisol levels are going to rise. That's normally what happens to wake us up in the morning. But in a sleep apneic individual, they have this going on all night long. So they get spikes in cortisol. What does cortisol do? It raises your insulin. What does insulin do? It makes you hungry. It makes you want to eat more carbs, want to have more sugar in the bloodstream. And then you want to wake up in the morning and you're like, I'm so tired. I can't wake up. So what do they go for? The bagels, the sugar, the candy, iced coffee, the sugar in the coffee, that kind of thing. I know people that drink close to 5 cups of coffee a day just to stay awake. All right. I have a man who's now he's just turning 60. He can't even wear the normal CPAP. He tried a CPAP. He has such bad panic attacks because he can't keep it on his face. He feels so claustrophobic. His nose is so narrow internally, and yet he won't let me expand his mouth. So he's suffering. And now he's getting more autoimmune issues. He's gained weight, and these all complicate the situation. But in his instance, he's like, well, I can't afford it. Well, you can't afford to feel bad either. So I watch health go downhill with people who question it, are more confused by it, maybe don't really have the money to spend on it. But oftentimes, when we diagnose them with sleep apnea, we can get their medical insurance to pay for it. Now, not 100%, but in some cases, yes. I just had a man come in more recently who's had squamous cell carcinoma. He's had part of his teeth and face, part of his palate removed, and he's about a year past that surgery now. And he's way overweight, and he knows it. And so one of the things that we know is that he's got sleep apnea already. He's wearing a CPAP, but he can't breathe through his nose.
Right.
Okay, so we're
pointless.
back to okay, what are we going to do? Because he doesn't have any teeth, I can't orthodontically expand him. So I have to deal with what is. And with him, I said, let's try a few things. We're using some cold laser on his face to get the muscles to kind of start to heal. We're doing some stretching because he couldn't open wide enough to get food in. So that was a concern. So what do you drink? You drink sugar drinks, right? Because you're hungry. And so we're now having conversations about the fact that squamous cell carcinoma has about a 40% survival rate at 5 years. And I said to him, you have to get off the sugar. If you want to survive this, we're now going to get real serious about it. And he's like, you're the only one that's told me that.
Mm-hmm.
His physicians aren't even telling him that.
And when you say expand the mouth, is that the palate that you're talking about? Can you
Primarily,
explain that a little bit?
Well, the teeth are in the bone, right? And the bone connects to the nose. So when we move the palate apart, and this is a very gentle, slow process. Doing a lot of palate expansions through the last 35 years that I've been treating with orthodontics, I found that fast expansion is tipping teeth and it's not really truly expanding the palate or into the nose.
Mm-hmm.
So I always did a turn the key every 3 days people are like, well, that's not going to go very fast. I said, the turtle wins the race here. Okay. So you want to go slower so that you can expand more easily. It's a lot painful. It actually works faster than if we try to force it. So the nose will slowly open up, and we can actually see those changes on x-rays. And personally, I think that's worth every bit of what we're trying to do.
Absolutely. Well, that's really interesting. So I really love these stories about, I mean, obviously this is like life-changing treatment that people are getting. Can you share some more personal stories about patients and what they've gone through and what their lives ended up being like after the treatments?
So I'm going to kind of back up and do this a little differently. I'm going to tell you the worst case scenarios. I had a 22-year-old. She was about 4'10", maybe 90 pounds, very pixie, gorgeous, gorgeous young woman. Her parents had died when she was 14, so she was a tech vet or a vet tech in New York, south of New York City. She had driven 3 hours up here to see me. She was in a lot of pain, thought it was TMJ, had been to multiple dentists, neurologists, had x-rays, CAT scans, all this stuff on her. They told her that they didn't know what it was. Maybe it was TMJ. So she comes to see me. So I threw her in my cone beam x-ray, and I looked at that x-ray and I was like, my word, this is bad. So I happen to know an oral surgeon in Maryland that's fairly close to where she lives. And I said, can you get down to him? Because he had an MRI in the facility next to him. So they were able to biopsy this area and found out that she had rhabdomyosarcoma of the face. So those were the pterygoid muscles. So what are those? Those are the ones that help you open and close. So she had half of her face resected, half of her palate, lost a lot of teeth, lost her lower jaw because they all attach. Okay. And if you remember way back when, the Kennedy boy, who was a great skier, or a ski racer, he got rhabdomyosarcoma of the thigh, and he lost his whole leg right up to his hip.
Wow.
So you can't fool around with some of these cancers anyway. But she had gone undiagnosed. Nobody paid attention. And unfortunately, she had a very devastating effect from the surgery. She basically was disfigured.
Oh, no.
So doing your due diligence, and this is why I talk about this, is real important, because they come in, they have pain. Everybody has pain. So you got to figure out, where's the pain coming from? This is why I talk like this, right? You would look like, oh, she probably has sleep apnea, but no, she did not. So you have to really do a good head and neck exam. You have to do a cranial nerve exam. You have to really start to look at things. So, and I'm like, she had seen so many neurologists. I'm like, why didn't they pick up on this? I don't know. So anyway, those are sad stories. And so you really need to pay attention to what is going on, what's happening. And I'm going to tell you, we have some people, even though they start treatment, they don't want to do the treatment. They don't want to wear their appliance. They don't want to cooperate. They just don't want to. And then they don't, and believe it or not, some of them get better, but not as good as they could be.
Mm-hmm.
And if they don't follow the diet changes, which a lot of them, especially men, don't want to do, then they're like, oh, this is terrible. This doesn't work. Well, they get better. They get out of the pain, but we could bring them further along. But, you could bring the horse to water, but you can't make them drink. So those are choices, right? I'll give you another example. I had a woman that came in. She was holding her face. I'm in so much pain, right? The headaches won't go away.
Headaches. Yeah, we haven't even discussed headaches. That's a big one, right?
Well, they go a lot with the TMJ. So she's got headaches, and she's like, I can't take the pain anymore. And I said, are you willing to, this is the truth. I said to her, are you willing to do anything? And she goes, anything. I said, you sure? You're willing to do anything, right? She said, yes. So we chested her. She had sleep apnea. We got her into an appliance. In this particular case, her airway wasn't terrible, so we opted to just make her an appliance. She was doing great. She started getting out of pain. And about 4 weeks into this, she's like, I'm doing great. And I see her at 5 weeks, and she's back in pain. And so the first words were, I guess she didn't like feeling better. What did you do? Because she didn't do something, right? And she's like, well, I didn't want to wear it to bed the whole time. And I really didn't want to, and we go back to this again. So she messed with the system. So I said to her, you're going to have to go back and wear this because your condyles are not healed yet. So in this time frame that I work with them, which is anywhere from 12 to 16 weeks, we see the bone around those condyles, which is usually inflamed, starts to calm down and they heal. Wow. Amazing concept, huh? Bone heals. So we worked with her. We got her nearly done, and she started having these weird vertigo things happening. And I said, so I started to go back, and I'm like, okay, what are you doing? And I'm like, what do you do all day? Well, she was a therapist, but she worked Monday through Thursday, and she would talk for 10 hours. And by Thursday, she started having vertigo. So now I'm starting to look at her, and this is where knowledge becomes important, right? And I said, I think you have a carbon dioxide oxygen ratio problem, and that causes the body chemistry to change.
Wow.
And she said, I think I need to have a neurological workup. I might have a brain tumor. Okay, go get your neurological workup. Turns out they didn't find anything wrong. She had scans and MRIs and everything, and nothing was wrong. And so I finally came back, and she said, well, now what do I do? I said, you're breathing too much through your mouth. You need to breathe more through your nose. So you're going to lip tape at night. So she started lip taping, and she's like, oh, vertigo's gone.
Wow. It's amazing how important that is to breathe through your nose.
So you can't make everybody lip tape, because that starts to send them into panic mode. And I said, well, you can't lip tape until we can breathe through the nose, and you haven't been using it. So now we need to learn how to use it, and then we can lip tape. So it's not something you're going to start off with. Now I have other people who are runners. I get the guys who like to climb the cliffs and all that sort of thing. They kind of start to understand that, because they have to be in pretty good strength and health to be able to do these events, right? So, and there's competitions that they can enter. I didn't realize how much there was on that until you start talking to these patients. And so now it's come to my attention that for the Olympic athletes that do track and field, they're all practicing with lip taping.
Really?
So what does that do? This is really interesting. They get less lactic acid buildup, so their muscles don't hurt as much. They can actually run farther and perform better. Interesting, right?
Mm-hmm.
Thinking, here's that body chemistry again, coming back to in that feed loop. So when you're looking at these things, it's like, once again, I have to, which tool am I pulling out of my toolbox to fix them? That's why nobody's exactly the same.
Right. And it's interesting to me too how you incorporate nutrition as well. So when you're sending people off back to the 3 hours away where they drove to, and
Yep.
you're sending them back with a nutritional plan too, to really kind of solve the whole problem.
Yep. Well, we keep evolving with that, because we keep learning more information. But basically, we started off with, let's get you gluten-free, okay?
Mhm.
Because we know that that's a big inflammatory marker. And the men kind of push back, but not all of them, because some of them are the cooks in the house. They're the ones that are buying the food. So if they are doing that, they're great. If I can't get the cook of the house on board, they kind of get sabotaged a little bit, and it's really hard to go out and find gluten-free meals.
What else is gluten? I know it's in bread, but what else is it normally found in a lot?
Pasta, it's in wheat, it's in hair care products, body lotions, it's in
Wow.
cornstarch sometimes. You've got to really look and read every label.
And it says gluten, or is it labeled something else in like a body
So
lotion?
you won't, it'll have wheat in it.
Wheats. Okay.
Okay, so that's what you're in, and of course they put it in micro print, so you got to use a magnifying glass to look at it. It's so tiny. But people don't realize it's in all of the skincare products. It's not in everything, but it's in enough stuff that you really have to go and look through the products that you have. I did it in my own home, and I had to throw away a whole box full.
And
I
it's
was like,
literally labeled wheat on there.
oh yeah, there's wheat on it. So that gets absorbed in through your skin.
Yeah, I'm going to definitely start looking in our house, because I've never looked at the ingredients on lotion before.
Right. So for most people, they can go gluten-free. We keep them down. There are certain other things that I don't want them to eat a lot, like peanuts, because they have a lot of mold on them, and mold really kind of wreaks havoc with certain individuals. But if we get them on a good nasal spray, which helps open them up, deals with some of the environmental allergies, and you don't know what's disturbing their sleep. So I have some people. I had one woman that came in with her husband. Turns out it was their EMF, because she was absolutely fine when she was here, but she would go home and she's like, I get these headaches. And I said, what's on at your house? Turn off everything. And so when they turned off the Wi-Fi, her headache stopped. And so for some individuals, I have to suggest, they're very sensitive to the EMF, and I'll tell them to put their routers on a timer, so they go off at, say, 11 o'clock at night and come back on at 6 o'clock in the morning. And then we notice their sleep improve. Now, interestingly, a lot of these people think they have an Apple Watch and it's going to tell them everything.
Mm-hmm.
Well, Apple Watches are okay for a general gist. They are not okay if we're trying to track some very specific things. So I usually suggest for some, when we finish treatment, that they get an Aura ring. There's an app on their phone, and it will tell them how long they're in deep sleep, how long they're in REM, and how their oxygen desaturation is going. So those are really important markers that we're looking at. And we can watch if they get off the track of the diet, all of those things go up. They start losing the amount of oxygen they're getting at night. Their inflammation in their nose swells up the nose, and then it's not like they need an expansion. They just need to get on a different diet.
So it could be, what was the word you used?
Well, gluten-free is one.
Well, I'm sorry, you said gluten causes, I'm blanking on the word.
Inflammation.
So it could be inflammation or weight gain or both, that
Yeah.
as that goes up, you see
Well, the gluten is part of the weight thing. It's the sugar, because this stuff turns into sugar in the body. So you have to remember, now you've got to get off the rice and the bread. And I made my own gluten-free bread. I maybe have one slice every month, maybe. I got out of the habit 30 years ago. I just don't touch the stuff. But when I touch the stuff, it's like having a glass of wine. I don't sleep well that night.
Interesting.
Yeah. And I'm very affected by alcohol now that I've been pretty much, I don't drink any alcohol. It's not like I'm a teetotaler, but I get together with my girlfriends. If I have a couple glasses of wine, I know I'm not going to sleep well that night.
Yeah, I know a lot of people like that. They don't drink, and then they go to Las Vegas and drink a lot, and they don't sleep for a week. So absolutely. Well, this has been amazing. Thank you so much for joining us, because I just love hearing the stories of the treatments that you've done. And tell me, if somebody is having these issues, that they're having pain, if they're having sleep issues, if they're having TMJ and they're having trouble getting it fixed, can you just walk through real quick, if they were to travel to you, what that first visit would be like?
Well, sometimes they can get me information before they get here. So we kind of cut to the chase a little bit. We might make it a longer appointment. Sometimes they can get a sleep study done by their physician where they are. I ask that they make sure that the sleep study includes the respiratory distress index, because that's how I know how well their nose is functioning. Most sleep physicians don't even understand that. The group that I work with does. So they actually add those two things together, their sleep apneic events and their respiratory distress. And if they're oxygen desaturating, that gets included as well as a key situation that needs to be improved. And sometimes people just don't go quickly enough. Their life is busy. They forget it's not that bad. I'm okay. I'll take some medication. And I had a woman who was a premier IT person here in Hartford. She was 62 years old, and she couldn't follow the directions on how to do the sleep test. So we kept having to talk her through it and get on the phone with her. And we finally got the test. And then she came in for so I could tell her what the results were. And she said, I've just been diagnosed with dementia.
Oh, no.
Her oxygen desaturation went down into the 60s. So here she is. She cannot breathe through her nose. Okay. So she wasn't slim. She was a little overweight. She was 62. Most women gain weight with menopause, so that's always a concern. And we see a skyrocketing when hormones change for women, especially when they just skyrocket into sleep apnea and they don't know why. But estrogen is very protective, and now we're having less of that in that age group. It's trying to figure out, are we having a hormone? And I had one woman that we started going through the screening, and I said to her, you really should get your hormones checked. I think there's something going on here. And they found out that she had a tumor in her brain.
Wow.
And, I'm not going to test for that, but I certainly can make suggestions that, these are things that need to be looked at. And her regular physician was really reluctant to do that. And so she went to a naturopath who said the same thing. And so she's like, okay, I guess I'm forced to do this. Turns out it was kind of wacko on the test. They did an MRI and they found this tumor.
Wow, that's sad.
Well, it's not sad.
I guess it's good they found it. Yeah.
She'll get it fixed, right? But she's this great lady. She has 3 kids, and her husband passed away a few years ago. So she's been stressed trying to take care of the family and do all this. And now she's got to go through a major surgery. So it's those kinds of things that scare people and put off trying to get things resolved. And she just didn't know why she had so much anxiety. So one of the other things that raises anxiety levels is sugar. And this is like hard to believe that sugar is so bad, but sugar is really bad. And so we get people to kind of change what they're eating and kind of monitor things a little bit more. And we give them some encouragement. I don't think most physicians talk like this because they are nutritionally deficient in training. So we start to change their lives around a little bit more, especially during COVID, because we were using a particular kind of product to help people flush their noses, to help them open up their airways, especially if they've had some bad prior nasal surgeries. All those people didn't get COVID.
Interesting.
It's really amazing the things that you learn. And I had many people calling me during that time going, I'm going to die. And I'm like, nope, you're going to do these things.
That's
We're
great.
going to build up your immune system. You're going to be fine. And everybody lived. It's scary when the government and the news especially just kind of goes crazy on all that stuff.
Yeah, that was a very difficult time. There's no doubt about it.
Yep.
Well, thank you so much. If there's anyone listening to this, doctors, dentists, or even patients who are experiencing these problems and they want to reach you, your website is theburlingtondentist.com. You can call Dr. Brenner there. And I know that you're, like you've said, you're willing to talk on the phone with people who are experiencing these problems yourself, and give them some advice and tell them when they should come see you. So thank you again so much for your time. I really do appreciate it. It has been a pleasure.
Well, thank you, Ben.
All right. We'll talk soon.
Okay.
Thank you for joining us for this Dental Flow podcast episode. If you enjoyed today's discussion and wish to stay updated on future episodes, please like, subscribe, and share the podcast with colleagues and friends. For more insights and discussions on dental marketing, we encourage you to continue riding the Dental Flow wave and tune into the next episode. Keep on smiling, learning, and flowing with the Dental Flow podcast.